All right, it is Friday. We're approaching a holiday weekend, and we appreciate any of you who are dipping in here with us on Facebook Live. We every day dive into coronavirus, a little bit deeper dive inside the Arizona coronavirus numbers so that you can make the best decisions for your family based on how the numbers are looking day in and day out. We're going to help you find that information, get to what you're looking for, and then highlight some of the things we are noticing with today's numbers, being people that stare at the numbers every day since January. So we're going to walk you through some of the things we're finding. If you have any questions, post them in the comments and we'll be sure to get answers. My name's Katie Rammel alongside our data guru, Garrett Archer. And Garrett, let's get right into it. Some of these numbers coming out today, there were a few high numbers that we should highlight.
Yes, so just to go through the summary of the numbers, I'm going to share my screen so that everyone can see the AZDHS data dashboard that we get all of this information from. We have a total of 91,000 or 92,000 cases, nearly 92,000, 1,788 deaths. That today came to 31 new deaths added, 4433, which is a very high number of new additions. It's not a record, but it is a very high number. And we did have, as you can see down here on the PCR, the diagnostic tests that are the primary driver of these numbers. We had about 17,535 tests put into the system today, and that is a record number of tests. So we're starting to see an increase in the number of tests that the state can process, or at least the laboratories can process. So that's at least somewhat encouraging news that we're starting to see a larger number there.
Yeah, a larger number of tests means we'll start to get a little bit of a better idea of how things look within our community.
Yes, of course. Now, this is the caveat on that, of course, is that if this is a larger number of tests that are being processed on at a quicker rate, or if we're seeing sort of a backlog of tests and it's taking them longer to process, and we're getting sort of these dumps of tests that really should have been processed 3, 4, 5, 6 days ago. So that's the concern. It's difficult to really tell where that's falling right now. What I can tell you is that when you look at the epi curves, the date of actual collection, everything seems to still be within a 7 to 10 day period, and that's sort of what we've been expecting. We've been seeing that since the very beginning. So that at least tells me that unless they're giving us an incorrect date of collection, that we're not seeing a massive slowdown in testing.
Yeah, and I want to stress, anytime you see sort of an anomaly in the numbers that come back, you're going the extra step to call over and make sure that there's not some problem with the reporting or not some problem with the numbers that are coming out.
Yeah, we did have some of the other numbers to highlight, which we'll go through what you just said. The first one I want to highlight is in the hospital usage and availability, and we look at the ICU beds, and we are now at 91% occupancy in the ICU beds. Another caveat to make here, this is licensed beds. We've been told about 640 extra beds that can be added to the capacity if we need them. But as of right now, with the licensed bed number, we're at 91%. And then the number that we have to kind of verify right here is this COVID-19 emergency department visits. As you can see, there's a massive increase from the day before to yesterday, from 1371 to 1847. So that's almost 500 emergency room visits that were reported yesterday. So now data collection or data input issues on this is not entirely unheard of. We've seen it before. There's look, never mind. It looks like they fixed that. There used to be a
wow.
there. And I was going to say this used to have a data issue, but it looks like they fixed that.
Mm-hmm.
But there, so which it means to me is that if there is a data issue on this, it will be fixed in about a week or so. It takes a while, but what I was trying to point out here is several days ago there was one of these right here that was much lower than the rest of these inpatients, and it was obviously. Because it did not fit the trend at all. It was obviously an incorrect reporting issue. And we're still trying to find out with the AZDHS if that is also an incorrect reporting issue or if that is a valid number.
So once again, for people just hopping on, that's pertaining to emergency rooms.
Yes, it's emergency room visits. So there's a little difference with emergency room, just to explain it. All of these are all beds, inpatient beds, ICU beds. Ventilators are obviously not beds, but they're attached to beds. The COVID-19 emergency rooms are people who just go into the emergency rooms for COVID-19. So they're not necessarily occupying a bed at this time, but it is people who were seen in the emergency department.
Okay, I'm seeing some of these comments come in, and I want to get to some of them. Mizzy writes that Mizzy's waiting in her car right now at South Mountain for the free COVID-19 testing. She says she's been waiting there since 6 in the morning. Mizzy, first of all, we're thinking of you. We know how long those lines have been. We've been out there tracking those lines. Yesterday, they ran out of tests that they had to shut down early. People were still showing up in the evening. She says she's been there since 6 in the morning. That's what time it opened. And we ran into folks last night at 10 who were trying to get in line. It doesn't sound like they were allowed to get in line, but they were at least out there trying to park their car overnight. Just enormously long lines. If you want to join Mitzi out there and get in line, you do need to bring your ID, but I want to remind you or caution you, it's almost 2 o'clock in the afternoon, about 1:45 in the afternoon here in Phoenix. And it was about 3 o'clock yesterday that they were saying they didn't have any more tests left. So just something to think about. Garrett, what were some of the other, one more comment I wanted to get to really quick. Lisa posted on there that she just lost a friend to COVID-19 yesterday. So Lisa, I don't want your comment to go by without us pausing to talk about that. I'm so sorry about the loss of your friend. I understand how brokenhearted you are. I've had so many friends and family that have either lost a parent or lost a friend, and it does not get any easier despite everything that we're going through. So Lisa, this is why we continue to do this, so that people can understand these numbers out there. Garrett, what other numbers were you seeing?
Today, let me just pull up one of my, I'm going to stop this really quick. I'm going to pull up a chart that is sorry, 1 second. Okay. Give me a moment. I should have had this chart prepared and I was not, so I apologize.
Okay. Let me tell folks while you're pulling those up, Honor Health has a few matters of business that I want to pass along. Honor Health is telling everybody if you have symptoms of COVID-19 or would like to be screened, you can start at their website. It's honorhealth.com/coronavirus-COVID-19/testing. Now, I know that's a long address. I'm going to give it to you one more time. honorhealth.com/coronavirus-COVID-19/testing. That is where you can check your symptoms and then connect to a caregiver. And then from there, you're going to be directed to the appropriate place to get care. They are also wanting me to remind you, please do not go to the emergency room for COVID-19 testing unless you're experiencing a life-threatening emergency. The emergency department visits, they say, will result in a charge for the emergency department as well as the charge for the test itself. So go to that website first. Obviously, this is totally different if you're experiencing a life-threatening situation, then by all means, go get help. But if you're just looking for COVID-19 testing, don't show up at the ER. And again, that's coming from Honor Health.
Yes. So I wanted to go through these charts really quick. It will show you some of the vitals of what we've had today. So this is the cases that were reported by the Arizona Department of Health Services. This is what it's looked like since the very beginning with a 7-day rolling average. So as you can see, we've had a couple little blips here and there, but it's still, for the most part, the slope is going up. We have here the testing. You can see the record testing day we're having right now that's just come off of a very close other, this used to be the record, this is now the record. So we're having sort of, step-by-step day records. The death numbers, the number has, the rate has increased. And we can see that has a lot to do with this one right here, which was a report of 88 deaths that they made about 3 days ago. And then the important number to look at right here is this percent of positive of the COVID test. Right now, as far as the daily number, so this is a daily ratio, not necessarily the actual date of collection and date of positive, but we're looking at about 1 in 4 tests that are being reported to the State Department or the Health Department right now are coming back as positive.
An incredible number. What does that look like over the week to week? Is that the same percent that we're seeing coming back positive? I know yesterday we had a high percentage number of 30% positive tests of the daily rate. But of course, that is just the tests that were coming back. It doesn't mean that those just happened in the last 24 hours. So how does our week-to-week average of the percent of positive tests look?
So I'm going to direct people again to the AZDHS dashboard. The good thing is a lot of the questions that Katie is asking, a lot of this information is readily available to anyone from the public. This is right here. If you are on there, go to their dashboard and you go down to laboratory testing. You can then come down to see these two charts right here. This is the percent of positive tests by week. So what Katie was asking, we can see that as of right now, about 19,000 tests have been collected from the week of June 28th, and that percent positive is 22%. So it is a little lower than that 25%, and that has something to do with all these tests being rolled in over time. So, but we can see we still have a record number here at almost 100,000 tests from the week of June 21st, and that's 20. So 1 in 5 of the tests that came back of the week of June 21st came back positive, and those are actual date of collection. So these are more an accurate reflection of what's going on.
Garrett, one of the other things that we were looking at today was some interesting perspective on credit card use and how that is reflective of the tests that we're seeing here in Arizona. This chart was put together outside of ABC 15, correct?
Yes, this is actually a chart by a Forbes journalist that I will share really quick.
A really fascinating look at how things are changing for us.
So this is basically what they did was JP Morgan and John Hopkins, right? Or JP Morgan basically had anonymized credit card data, and what they did is they looked at all the states and figured out who was spending more on restaurants after the shutdowns. So as you can see for 3 weeks ago, if you can see. So here's all the states on a plot line. This is the this is the amount of change in new cases per million population, and then this is the amount of spending that has declined. So for 3 weeks ago, we are now spending 30. It's 30% more in restaurants, if you will. And you can see right here we've had a very high case growth, but we also have a very high number of credit card transactions that are now occurring that did not happen in the past.
Just a fascinating look at things. You can see all those states filled in along there and kind of get a closer look at maybe where you're from in addition to just Arizona's numbers.
Yeah.
Is this an interactive map that people can make larger? I know you and I both retweeted it today. I didn't click through it to see if they can see it a little better, but
let me try to make it larger really quick.
I know it gets difficult to see some of the states when they get all kind of clumped in there in the center together, but really interesting look. And I wonder if you could maybe find this on the Forbes website too. I'll direct you.
I would presume they have something at this point, but this is a very interesting chart. They just completed this yesterday, and you can find this on Twitter. It's kind of going around all over the place right now because you can see there's a very high correlation between those states that are these Sunbelt states, if you will, these states that are having a higher than average COVID-19 increase, and then some of these other states that are not having the same. Yeah.
Wow. It's just a really fascinating look at all of this. We're headed into a holiday weekend, obviously. It's Friday. We will still probably continue to see some of these high numbers on Saturday, wouldn't you think? But then the lag might, the lag in lower numbers or lower places reporting over the weekend, or do you think that we'll still see some bigger numbers?
Yeah, I actually expect that numbers this week are probably going to be lower considerably for the next couple days because a lot of county health departments are taking today off in lieu of, obviously, since July 4th is on a Saturday, they're going to be taking today off. So I would assume that we may have very low reporting tomorrow, but on Saturday, Sunday, and possibly Monday, we should have lower reporting. Now, we've had kind of instances where that's been changing. So, when this thing's been going on for over 100 days, and we were at a pattern for a very long time where it was always Sunday, Mondays that were the lowest, and we have had a couple of exceptions that are occurring more recently. So while we expect to see much lower numbers this week, especially in the death number, that's very important to say because those county departments will be closed. So it's very likely we're going to be having death numbers of 0, 1, and 2, and just very, very low numbers over the next couple of days. and then it will pick back up on Tuesday. As far as the reporting, again, this is all about the reporting, not when the actual date occurs, the date of death occurs. So what that just means for us is that it's just difficult to see a trend over the next couple of days. It would be very difficult. If we look on Monday and we're looking at what happened over the course of the 3 days, we might be like, oh, well, deaths are going down definitively. But then in the next 2 days after that, we have 2 very high death reports, and that sort of changes everything. So it kind of puts us on a wait and see approach when it comes to the COVID death numbers.
Yeah, so maybe if you're seeing an exceptionally high number or an exceptionally low number over the weekend, it's better to look at things on a longer term basis so you can get a better idea of how those numbers actually shake out. All right, anything else that you wanted to cover? We'll be a little more brief as we head into the holiday weekend, and then regroup next week for some more conversations on this. And if anybody has some questions coming in. Here's an interesting one from David. Is there data that separates restaurant purchases between takeout and dine-in? I don't know that they separated that out on that graph at all.
Yeah, that would have to be, they may have that because this is JP Morgan. These are Chase credit cards we're looking at. So, I would imagine they have that, but I don't know if on the transaction itself it says if, they would have to do a lot of sort of cross-matching to see if it's a takeout order or not. I don't think the transaction at a restaurant sort of shows if it's a dine-in or takeout. So I'm kind of walking back my response a little bit. I'm not exactly sure we're going to find that.
Well, it'll be interesting. I'm just fascinated that they were even able to pull the restaurant numbers to do that. It's just an interesting way to see how reflective those are. Oh, Sherry, you're welcome. We're happy to pass the information along and happy to help people find where they can find this data when we're not here to help direct you to where this is. Good websites to check since we're not here over the weekend would be the Arizona Department of Health's website. There's a summary that comes out every single morning that you can look through the numbers that we track so closely. For those of you in Maricopa County as well, Maricopa County puts out a sheet and you can check out their health numbers, which for those of you that live in this area, it's just going to help you get a better idea of what things look like. And you can look back at past numbers. So just a couple of places to go peek at things. And the other spots where you would direct people, Garrett, besides, of course, abc15.com/coronavirus. That is where you can find all of our reporting right there. Oh, Bill's asking, what's the % of those who have recovered? We'll just touch on that really quick as we do each day. Bill, thank you for the question. There's no agreed upon definition for recovery. What's recovered to me might not feel recovered to you. So the state does not necessarily define that just yet. The closest thing that we have is people leaving the hospital. And so we have those numbers. It looked like at last check, they were around 10,000. Garrett, did you look on COVID?
Yeah, it's a little above 10,000 right now, discharges.
Okay.
It's the best number we have, just like you say. It's not a perfect number, but it's the only thing we have that may even be discharges. I've gone back to the AZDHS to get further definition of what they're considering a discharge, to just make sure that, because there's situations where a death could be considered a discharge, a transfer to a hospital, another bed or an ICU could technically be considered a discharge. So there's just a lot of gray area in discharge right now. So as soon as we get those definitions shored up, we should have something a little better.
Yeah, like Debbie Boss is saying right now, leaving the hospital is not recovered. Exactly. Some people feel that is not an accurate number. That's the only one we have. People press for these questions so much, and we just don't have that number. That's the closest thing you can track, and that is on covidtracking.com. Use the pull down bar to choose your state. You can choose Arizona and then see Arizona's around 10,000, but you can see any of those. Okay, could you repeat the website for Honor Health, please? And thank you. Yes, I can. Let me pull that up again. Look at producer Carrie's so good. That's exactly it. honorhealth.com/coronavirus-COVID-19/testing. That's coming from Honor Health. Now, each of our providers should have a similar website as that. Honor Health sent that one over. And again, for those of you who hopped on here a little bit later, Honor Health saying, please don't go to the emergency department for COVID-19 testing unless you are in a life-threatening situation. So many people have asked about the situation between the gyms who are not shutting down in the governor's office. there has been quite a showdown between some of these gyms and the governor's office. So we are staying on that today. I know the governor's office just issued another letter out to those gyms, and we will have full reporting on that coming up for you at 4, 5, 6, and 10 p.m. tonight. So they're still going back and forth, and we'll continue to track that for you. All right, Garrett, any other questions that you were seeing coming in that we should?
I had one thing from yesterday. Someone asked about the age groups and sort of how we can chart those. So I have for you, hold on one second, my apologies. I have for you a chart here. This is the COVID-19 confirmed infection rates by age. So this is a per capita chart. It's per capita 100K for each of these population groups. So this actually sort of evens out the COVID cases within these population categories, because obviously, 2044 is a much larger population than 45-54. But here you are, as you can see, the under 20 population. This is the one right here. They have the lowest per capita in the state. The highest comes at the 20 to 44 range, followed by 45-54 and 55-64, and then here's over 65. So what the most concerning thing about this chart here is about 2% of people in the state that are between the ages of 20 to 44 have tested positive for COVID-19.
Wow. And is this the chart you just put together within the last 24 hours, Garrett?
Yeah, I literally threw this together just before. I'm gonna make it a little better, but I put this together just about 20 minutes before we came on here.
So walk us through it one more time. What you're seeing on each of those lines is a little hard to see.
Yeah, I'm gonna make it a little. I'm gonna work to make this a little easier to see. I know some of the colors are a little too similar. So this is the under 20 age group. This is right here. As you can see, everything sort of starts here, and they've always been the lowest per capita. This is the 20 to 44. This is the age group that sort of has been driving the COVID-19 infections over the last several weeks. And you can see right here, it really, at first they were not higher than the 45 to 54, and then it started to shoot up. And now about 2% of people who are between this age group have tested positive. And here we are with the 45 to 54 age group. This is, this is the next highest and also youngest group that is impacted here. And then we're here at the 55 to 64 and over 65. So this is the high risk group right here. If you have to find some good news in this, it's that the per capita number for the over 65 is not considerably higher, because the majority of deaths are going to come from this group.
Yeah. What sort of percentage are we seeing that we're losing in that group right now, those who are testing positive?
The last I checked, it was about 90%. I mean, it's about 90% of the deaths are coming from the high risk group.
Yeah.
I have to check to see I don't want to say anything about the percentage, the case fatality rate of that group, because I haven't looked at it recently, and I don't want to give a false number.
And that also is coming on the Arizona Department of Health website? Or
yeah, all of this is on. You could actually do that if you want as well. You could go to the AZDHS.gov website and look at the categories for the infection rates, and then the death rates, and then put your own sort of simple case fatality rate together for the age groups.
Yeah, I just want to highlight Amber's comment that just came in. Amber, thank you so much for recognizing that. She writes, they're literally teaching people how to understand and read the data. Being educated doesn't mean being fearful. Thank you. Amber, that's exactly what we're trying to do here, is teach people how to find the numbers for themselves, how to read and analyze the data for themselves so that they can make the best choices for their families. That is exactly what we are trying to do here. Help people find the information they want so they can make the best choices for their kids, going back to school, going to the gym, whatever that is in your life, whatever that metric that speaks the most to you, that you find you can track, and then be able to make the choices for yourself. I know I'll keep my percentage and my number private, but literally there was a metric that I was tracking closely, and I said, if we get to that percentage, I feel that it would be safe for my family to go back to the gym. And we approached it, and then it went away again. But it was my personal number to watch for, my choice for my family. And that's what we want to do for everybody, so that they can find the numbers they want and then make the best choices. So Amber, thank you for getting it. That's exactly why we're jumping on here, taking time out of our day to help you better explain all of this. Anastasia writes, knowledge is powerful, or is power, stay powerful. Exactly. So great. Is there any way to rewatch this? You logged on late. Katya writes that. I hope I'm pronouncing your beautiful name right. Yes, this is going to be on Facebook. You can find it on our pages or on ABC 15's page as well. My Facebook page is facebook.com/news from Katie, and Katie's with an IE. Garrett, you reposted on your Facebook page, don't you? Do you have a public?
No, I don't. I don't. Sorry.
Garrett, the best place to find Garrett is on Twitter. Let's talk about your Twitter handle. It's @Garrett and then _Archer. He goes through all the numbers in the morning. I tend to retweet his numbers. They're just so good. It's the best breakdown of where you can find everything. So Paris writes, thank you. Paris, thanks for joining us each day. We appreciate that. She was on here yesterday with us, so we appreciate you popping on once again. Any other items that you want to get to before we wrap things up on this holiday Friday, Garrett?
No, just hope everyone has a safe 4th of July weekend, and you know, we'll be watching the numbers during the weekend, and if we see something very interesting or something that, you know, needs to be reported on, we will.
Yeah, I'll be right here for you. Obviously, the very latest on abc15.com/coronavirus, or join us a little later this afternoon for our newscast at 4, 5, 6, and 10. Be safe this weekend. It's going to be a very different holiday, but be safe and be smart, and we'll see you back here next week.